Hello, my name is Jacquelin Branche, and I am a third-year clinical psychology student in the doctoral program at the Chicago School of Professional Psychology in Washington, D.C. The title of my poster is The Patient-Provider Relationship: Predictors of Black African American Cancer Patients' Perceived Quality of Care and Health Outcomes. Now, disproportions in the quality of care and health prognoses between Black and white populations with cancer in America are well documented. Interpersonal influences lend themselves to these disproportions. So this study looked at the patient-provider relationship, or what's called PPR, which is made up of handling uncertainty, replying to emotions, decision-making, promoting healing, activating self-management, and discussing information or communication. Former studies have looked at PPR in a cancer setting, but those studies consisted of the provider's effect on quality of life, racial and ethnic inequalities in patient-provider communication, and the survivor's outlook regarding the quality of their physician's statement. What was found in those studies is that effective and caring communication with cancer patients and their families benefits the patient's care, the patient's value of life, the patient's satisfaction with care, and the patient's prognoses. However, joint communication and decision-making, emotional support, and how the provider communicates with Black cancer survivors had hardly been studied. So now the purpose of this study was to look at this population of Black patients with a history of cancer and who were survivors and assess the correlation between the patient's views of their PPR, which consisted of communication, emotional support, joint decision-making, the quality of care they've received in the past 12 months, and their perceived health status. Now, the outcome variables in this study were based on self-reported responses on quality of care and self-rated health. The predictor variable was the PPR itself, which was calculated from 8 items. The first category was providers' communication with survivors. This included asking questions, understanding, and clearly explaining to the patient. The second category was emotional support, which consisted of feeling of uncertainty, feelings, and emotions. The next was time spent with survivors, and that included whether they spent enough time. And when I say they, I'm talking about the providers. And then finally, involvement of survivors in decision-making, which consisted of involving the patient in decisions and relying on those decisions. As I went through this study, a couple of questions came to mind. If Joe is afraid or anxious, what might be going on in his brain? And also, what other perceptions might help Joe's recovery? So I hope that you will enjoy viewing my poster as much as I have enjoyed putting it together. Thank you.